was uns am meisten interessiert, ist der Schlaganfall, der durch Vorhofflimmern ausgelöst wird.
We're particularly interested in strokes caused by atrial fibrillation. The consequences are especially dangerous, and patients who suffer from a stroke caused by atrial fibrillation are more rarely able to return home from nursing homes and to regain their ability to speak and their capability to cope with everyday life. For this reason, strokes caused by atrial fibrillation are particularly severe.
Besonders gemein.
Atrial fibrillation is a widespread disease which causes approximately 50,000 strokes per year in Germany and accelerates the progression of vascular dementia. Atrial fibrillation is the biggest single risk factor for a stroke. At the beginning, it usually occurs sporadically and without symptoms. This makes it difficult to diagnose by conventional means. The prevalence of atrial fibrillation increases with age. Smokers, people who are overweight, diabetics and people with cardiac insufficiency or hypothyroidism are also at a higher risk. The disease can occur in competitive athletes of any age.
Vorflimmern kann Symptome machen.
People with atrial fibrillation may have completely unspecific symptoms, such as profuse sweating. Other people with atrial fibrillation often don't have any symptoms at all. Atrial fibrillation can also occur intermittently. The patients cannot tell us what causes the episode because they aren't usually aware of it themselves. So the patient comes and complains about something being wrong. We do an ECG but don't find anything. The patient leaves the surgery and already suffers from another atrial fibrillation attack on the steps outside.
Er geht raus und hat bereits auf der Treppe wieder Vorflimmern.
Approximately 1 million people in Germany suffer from atrial fibrillation without being aware of it. To detect atrial fibrillation, patients have to visit their doctor. Apoplex Medical Technologies offers a screening application called Stroke Risk Analysis (SRA) by means of an ECG to check the risk of atrial fibrillation. It is irrelevant if the atrial fibrillation is actually present or not. For SRA, an ECG of only 1 hour is recorded. During that hour, the patient can walk around. The recorded ECG data are sent via internet to Apoplex Medical Technologies, where the quick and anonymous evaluation is carried out by the Data Processing Center. The ECG analysis is performed using sophisticated mathematical methods. The result is sent to the doctor by email within minutes.
Bei Patienten, bei denen wir Vorflimmern diagnostiziert haben, müssen
Of course, we will introduce a therapy for patients who are diagnosed with atrial fibrillation. We can reduce the number and severity of strokes and, of course, reduce the destructive effect of strokes.
der Schlaganfälle reduzieren.
What was left to chance before has now become a specific quest. The SRA application offers the opportunity to detect atrial fibrillation in an early stage for the very first time, reducing the risk of strokes. Stroke prevention. Don't leave anything to chance.